Hello, in this video I'm going to be talking about Fulvestrant. The brand name is Faslodex. What is it? How is it given? And who might receive it?
Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerbba.com to take control of your breast cancer journey.
So Fulvestrant is actually most commonly given as an injection. It's given once a month, but the first couple of treatments are 2 weeks apart. So the first treatment is given in the muscle, then 2 weeks later the second loading dose, and then 2 weeks later the second monthly dose. So at first it's given every 2 weeks for 3 injections, and then it switches to once a month. This is often divided into 2 injections, one into each gluteal muscle or butt cheek, and it's given in two because it's a big injection and it can be really uncomfortable to get it in just one. Some people have written us and said that they get it in just one injection, and it's certainly an option. More recently, Fulvestrant is now available in an oral form, and though it can be harder to get, it's very expensive, so you may not have access to the medication. The way these drugs work is they are selective estrogen receptor disruptors or degraders. They originally were called disruptors and more recently degraders. So the estrogen receptor is really messed up, basically. It doesn't block the estrogen receptor. It doesn't lower estrogen. Rather, what it does is the estrogen receptor, and you might want to watch our video about estrogen receptors, are broken apart. So now estrogen in the body can't get to the estrogen receptor. Even after our ovaries stop working, we still make estrogen. So actually this medication works best in postmenopausal women where there isn't an ovarian source of estrogen. So these are injections, or an oral form may be available to you, given for the treatment of postmenopausal women with estrogen receptor positive breast cancer. These drugs are not used in people with early stage disease, not used in stage 1, 2, or 3 breast cancer, not used in ductal carcinoma in situ. They're used in people with advanced or metastatic breast cancer. They also tend not to be given as first-line therapy when somebody's just diagnosed with breast cancer, because we have other estrogen blockers and estrogen lowering drugs that are taken by mouth. If somebody was on endocrine therapy and then their cancer came back, this might be used as the first treatment for metastatic breast cancer. So when somebody's newly diagnosed with breast cancer in other parts of the body, we look at what treatments are they currently on. And if they're currently on an aromatase inhibitor or tamoxifen, we are going to consider the other drug for them or fulvestrant. If somebody's been on another therapy for metastatic disease, another endocrine therapy or hormonal therapy, we can switch them to fulvestrant. But what we try to do is use the oral drugs first and then switch to fulvestrant. So fulvestrant can be given on its own as the only anti-cancer agent, or it can be combined with a targeted therapy, in particular the CDK4/6 inhibitors. If you want to learn more about those, we have a video on 2 of those. One is abemaciclib, and the other is ribociclib. So you can learn more about those, and they can be combined with fulvestrant, and combined endocrine therapy and targeted therapy can be very effective. Again, this is only in people with estrogen receptor and or progesterone receptor positive breast cancer. What are the goals of treatment? Well, in people with advanced or metastatic breast cancer, what we're trying to do is prolong your life and improve your symptoms. So the main thing that these treatments do is improve your symptoms and control the disease. For most people, we can't cure stage 4 or metastatic breast cancer, but we can achieve control and help you feel better. If you feel poorly, you have hot flashes, you have aches and pains, you have other symptoms from these treatments, it's important to make sure that you don't feel worse on them because we're trying to make you feel better. So if you feel terrible, you have to make sure to talk to your medical team and make sure they know that you feel terrible and not just the symptoms, but the impact that's having on you. Because the goal of treatment is to extend your life with a good quality of life. So if you feel worse than you felt with the cancer, we're not achieving our goals. And this is where some self-advocacy and speaking up for yourself can be really helpful, or bringing someone with you who can help report the severity of your symptoms. So quick recap, fulvestrant is used in people with advanced breast cancer that's hormone receptor positive. The goal is to control the disease and treat symptoms and help you live as long as possible, feeling as good as you can. Highly effective. Fulvestrant's given by injection, though there is an oral form. And it can be given alone or combined with the CDK4/6 inhibitors. I hope this has been helpful. Questions or comments, just let us know below. We get back to you within a couple weeks. Don't forget to subscribe, and we'll see you next time.